Hi there everyone, and welcome back to the Sports Therapy channel. Today we're diving into a condition that affects many people, bursitis. So whether you're an athlete, an active individual, or just curious about this common issue, we're here to break it down for you. So let's get started. Bursitis is the inflammation of the bursa, the small fluid-filled sacs that cushion your joints. Think of them as tiny pillows that reduce friction between bones, tendons and muscles, and when these sacs become irritated, they swell, causing pain, discomfort and limited range of motion. The most common areas affected by bursitis are the shoulders, elbows, hips and knees. It's a condition that can range from mildly annoying to downright debilitating. So how do you know if you have bursitis? Well, here are the most common symptoms. So you'll experience pain in the affected area, especially during movement. There may be some swelling, redness or warmth around the joint. And in most cases there will be some stiffness and limited range of motion. The main thing is if you notice you have any of these symptoms that are persisting, it's worth getting them checked out by a healthcare professional like a sports therapist or physio in your local area. The cause of bursitis is usually due to repetitive motion or prolonged pressure on the joints. For example, athletes doing repetitive motion like throwing and running, prolonged pressure on the joints such as kneeling on hard surfaces, think of plumbers, electricians and builders, injury or trauma to a joint, or infections or inflammatory conditions like arthritis and gout. Age can also be a factor because as we get older, our bursas become less resilient, making them more prone to injury and inflammation. To diagnose bursitis, a sports therapist, physio or doctor might perform some orthopedic tests, a physical examination, and in some cases use imaging like MRI or X-ray to rule out other conditions. Treatment for bursitis often depends on the severity of the condition. For example, in the early stages, rest and ice, giving the joint a break and using ice to reduce swelling can be beneficial. Over-the-counter medication like ibuprofen to help reduce inflammation if tolerated can be beneficial. Physiotherapy, so exercise to strengthen the surrounding muscles and improve flexibility, can be highly desirable in a lot of cases. And then we come to the more invasive procedure like aspiration. So if the swelling is severe, a doctor might drain the fluid from the bursa. There's also the option of corticosteroid injection, as these can reduce inflammation quickly, but they're not particularly a long-term solution. And last but by no means least, surgery. Rarely needed, but sometimes necessary if cases are quite chronic and severe. Now, when it comes to bursitis, prevention is always better than a cure, and here are some tips to avoid getting bursitis. Warm up and stretch, so always prepare your muscles and joints before exercise. Take breaks and avoid repetitive motions. Use protective gear like knee pads or cushion mats, which can reduce pressure on the joints, and try to practice good posture to minimise unnecessary strain on the body. While bursitis can be painful, the good news is that in most cases it is treatable and preventable. By staying active and practicing good habits and listening to your body, you can keep your joints happy and healthy. If you've experienced bursitis, we'd love to hear your stories in the comments below. How did you manage it? Let's share some tips and experience with the community. And again, thanks a lot for watching. Don't forget to like and subscribe to the Sports Therapy channel and hit the notification bell so you never miss an update. Stay healthy and we'll see you on the next video. Bye for now.